y'all, NP Erika here from Mantra Aesthetic Studio in Virginia Beach, Virginia, and we are back with episode 2 of Talking Talks with NP Erika. So I got a lot of questions in my DMs after the first video, and so I'm so glad that people are actually very curious and asking questions about this. I know how frustrating it can be to go somewhere, especially a med spa, and feel like you're not equipped to ask the appropriate questions. So let's just go ahead and run down this list and keep it moving. Who makes Botox? Which is a great question. So Botox is actually a brand name, and the generic name of Botox is Clostridium botulinum toxin. It is actually a bacteria that in its normal state can cause significant illness. However, the manufacturers purify the bacteria and create very tiny doses in a controlled environment, bottles it up, and it becomes a botulism toxin for aesthetic use. So perhaps the most common known form of botulinum toxin is Botox, who is produced by Allergan, but there are quite a few others that give Allergan a run for their money. So that would be Dysport, Xeomin, Jeuveau, and the newest one would be Daxxify. And to be clear, those are just the ones that we're using in the US. There are others around the world that are approved in other countries. And all of these forms of toxin are safe for use in the US. They go through rigorous lab testing, and they employ purification processes that make the toxin safe for therapeutic and aesthetic use. Okay, so our second question would be, who should not use Botox? Great question. So the first thing is women that are pregnant or nursing. These medications are not tested in pregnant or nursing women, and so it is just best to avoid that altogether. Individuals with neuromuscular conditions like ALS, Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome should not use Botox, as it can exacerbate these conditions and cause your neuromuscular system to weaken or the condition to worsen. People with allergies to botulinum toxin, or depending on which toxin you're using, the additives that are added into the toxin. Some people have allergies to the saline, they need a preservative-free saline. Some people have allergies to human albumin, and some people have allergies to casein, which is a milk-derived protein. If that's the case, you will just have to consult with your provider to see which neurotoxin they're using, and then they should be able to ask you the appropriate questions to determine whether or not you would have an allergy to whatever toxin it is. Infection at the injection site. So if you are prone to acne and you have acne exactly where the injections would need to be, we should probably wait. What can happen is you go ahead and inject, and that can cause the infection to worsen or even spread, and we don't want those problems. We're coming here to look cute, not to get an infection and wind up in the hospital. There are other contraindications and precautions that are very patient specific, so really it's best to get a qualified medical professional to go over these with you at the time that you're signing your informed consent and getting ready to do your procedure. So the last question I received for this video would be, who can administer Botox? So this is a great question, and the answer is it's state dependent or country dependent. There are some countries where people need no licensure at all to give these types of medications. Botox is a medication, so I would not advise anyone to go to anybody that is not a licensed medical professional. So any doctor, DO, or MD, nurse practitioner, PA, or nurse can actually administer medications. Again, I appreciate you guys for submitting your questions. Feel free to ask more questions in my DMs. I will answer as many as you send, and I'll be back later for another episode of Talking Talks.